18 healthcare workers were arrested yesterday as they showed up to work at Colonial Heights Rehab and Nursing Center in Virginia. It's a skilled nursing facility. The state showed up in response to a patient death, a 78-year-old resident there, and they arrested 18 employees, including a nurse and the administrator, as they arrived to work. There are 7 counts of felony abuse and neglect of a vulnerable adult, 2 counts misdemeanor abuse and neglect of a vulnerable adult, 2 counts obstruction, and 27 counts of falsifying patient records. This is in regards to a 74-year-old patient that had a history of CP and diabetes, who allegedly was left in bed, soaked in urine and feces for days, not repositioned, not changed, and wounds, severe wounds developed. So severe, in fact, to her genital area that they initially thought she had been sexually assaulted. She was sent to the hospital and later died from sepsis as a result of that. I think it's interesting, however, that in 2023, last year, over 3,000 nursing home employees in Virginia filed complaints with Adult Protective Services alleging elder abuse, neglect, or exploitation. And so as a result of that, the state attorney general created the Elder Abuse Investigation Center. So how do we go from creating a whole investigation center to arresting the frontline healthcare workers? 18 of them from one place. And not shutting down the facility or holding the facility accountable. Now, be clear. I'm not saying that these employees aren't negligent. I don't know any of the specifics, but if it's true that a patient was left in that terrible condition, not repositioned, not changed, that's inexcusable, regardless of the situation and the resources and the staffing. That's inexcusable. But we're now arresting and criminally charging 18 healthcare workers. So over 3,000 frontline healthcare workers reported concerns of this type of thing taking place in that state just in 1 year. And the response is to go and arrest the healthcare workers.